NIBRT and Thermo Fisher Scientific have come together for a meeting at their facility near to Dublin in Ireland to discuss where we are going with the collaboration, which technologies they're using for which applications, and what the future holds.
Our collaboration between NIBRT and Thermo Fisher Scientific began in September 2016. The collaboration was initially focused on the chromatography consumables and LC hardware, but it's rapidly expanded to take in many aspects of what Thermo Fisher Scientific do.
Development of critical workflows for the characterization and monitoring of biotherapeutics involving liquid chromatography and mass spectrometry.
The application notes that we develop in the area of LC-MS and in peptide mapping are directly transferable to industry so that they can use the workflow that we develop to produce samples and analyze their massive workflows within a day.
So I collaborate together to give me the possibility to develop new methods that will be used for the next generation. So it's a huge opportunity, this.
I think what we are doing is it's really addressing industry needs in terms of having workflow for the biotherapeutic analysis.
Having access to state-of-the-art equipment such as LC-MS and QPHPLC is very valuable.
What you'll find is that some of the things we're doing, it's never been done before, that it's novel methodologies, but it's novel methodologies that are actually useful and relevant.
Working together with NIBRT is incredibly valuable for Thermo Fisher Scientific. We get to work with some of the leading scientists in the biopharmaceutical industry, from upstream and downstream processing and analytical characterization.
We see how the researchers at NIBRT are using them to enable their research. Similarly then, how the researchers at NIBRT are using those products to develop workflows which we can then take to market for our customers.
If you want to find out more about the collaboration and keep up to date with news and applications, you can visit thermofisher.com/NIBRT.